We're diving into another important immunohistochemistry test, the Isocitrate Dehydrogenase I, or IDG1, test. This test plays a critical role in diagnosing and classifying certain brain tumors. So, let's get started. Test information. Before we get into the specifics of the IDG1 test, it's important to know the pre-test requirements. Provide a copy of the histopathology report. The histopathology report is essential as it provides detailed information on the tissue sample that has been analyzed under a microscope. This helps in understanding the cellular structure and any abnormalities present. Site of biopsy. It's crucial to know the exact site where the biopsy was taken. The location can give valuable insights into the nature of the tumor and its progression. Clinical history. Providing a thorough clinical history of the patient is vital. This includes any previous diagnosis, treatments, symptoms, and relevant family medical history. This information helps in making an accurate diagnosis and treatment plan. Specifications of the test. The IDH1 test is a highly specific immunohistochemistry test that detects mutations in the isocitrate dehydrogenase I enzyme. Mutations in the IDH1 gene are commonly found in certain types of brain tumors. Identifying these mutations is critical because they can influence both the prognosis and the therapeutic strategies for the patient. Diffuse Astrocytomas Idh. The IDH1 mutations are primarily associated with the following types of brain tumors. Diffuse Astrocytomas. These are a type of glioma that originate in the star-shaped glial cells in the brain. They are often slow-growing but can progress to more aggressive forms. Oligodendrogliomas. Another form of glioma. Oligodendrogliomas arise from oligodendrocytes, which are cells that produce the protective covering of nerve fibers in the brain. These tumors often have a better prognosis if they have an IDH1 mutation. Glioblastomas. These are the most aggressive form of glioma and are known for their rapid growth and poor prognosis. However, the presence of an IDH1 mutation can provide critical information for treatment strategies. Identifying an IDH1 mutation is essential for typing and classifying gliomas according to the current World Health Organization WHO 2016 guidelines. It helps to distinguish diffuse astrocytoma from astrocytosis, which is crucial for accurate diagnosis and treatment planning. Specimen used. The IDH1 test is typically performed on a formalin-fixed, paraffin-embedded, FFPE tissue specimen. This type of specimen preserves the tissue's cellular structure and integrity, which is necessary for accurate testing and results. Components and Glioblastomas. The IDH1 test includes primary antibodies. These are specific to the mutated IDH1 enzyme. Secondary antibodies. These bind to the primary antibodies and usually have a detectable marker, such as a fluorescent dye. Detection system. This is used to visualize the binding of the antibodies to the IDH1 enzyme mutation, helping pathologists to identify whether the mutation is present. Test priority time. The IDH1 test typically takes around 7 days to process and report. This includes the time required to prepare the specimen, perform the test, and interpret the results. Test information and importance. So, why is the IDH1 test so important? Well, mutations in the isocitrate dehydrogenase Idh1 gene have been heavily implicated in several brain tumors like diffuse astrocytomas, oligodendrogliomas, and glioblastomas. By identifying the presence of an IDH1 mutation, healthcare providers can better classify and type gliomas according to the WHO 2016 guidelines. This is crucial because it not only helps in distinguishing between different types of gliomas, but also plays a significant role in differentiating diffuse astrocytoma from astrocytosis. In turn, this allows for more accurate diagnosis and tailored treatment plans.